For more on this controversial anti-malarial drug that Trump is taking, let me get some answers from Dr. Joseph Vinet, who's in New Haven, Connecticut. He's an infectious disease doctor and professor at Yale University School of Medicine. Doctor, welcome to our program. Let me get straight to the point here. Should U.S. President Donald Trump be taking hydroxychloroquine?
Well, first of all, thank you for having me. Second, no, he should not be taking it. I would correct the reporter. He's not taking it for prophylaxis. He's taking it really post-exposure prophylaxis, which is quite different than the whole population taking it as prophylaxis. He evidently had an exposure, and so he said, well, I'm at high risk. I'm going to take a magic pill that I hope is going to protect me. The problem in people with his age and weight and possible other issues is that there are real side effects of hydroxychloroquine, and it is not safe to do under those circumstances.
Well, let's talk about some of those side effects, doctor.
Well, we don't see, so the potential is for heart rhythm disturbances. What happens is the wiring in the heart gets kind of affected by the hydroxychloroquine, and we can see that as a warning on an electrocardiogram. It's called the QTc interval. And so about a quarter of people who are very sick with COVID-19 will have a prolongation of their QTc interval. I imagine that the president ought to be having daily electrocardiograms to make sure that he doesn't have a prolongation of that cardiac interval, so that he doesn't have sudden cardiac death due to arrhythmia.
So, Dr. Vinet, I'm really confused. Why would the president's doctor okay something like this?
Well, Mr. Trump's doctor is not unique. In the United States, we use drugs off-label all the time, and often at the behest of our patients. We have a very consumer-driven medical culture in the United States. So it's not really that uncommon for a patient to ask a doctor to okay a drug, as long as it's not too harmful. So that is probably the conversation that the president had.
And President Trump also claimed in making this announcement yesterday before reporters that healthcare workers on the front lines, many of them, according to him, are also taking hydroxychloroquine. Is that true?
I don't have any knowledge of that directly. I doubt it, but I really don't know. But what I can say, the bigger picture here is that for political reasons, Trump wants to have a magic pill that we can take that will prevent infection or to cure the infection quickly. At Yale, we are working on such a clinical trial of a pill to prevent or treat COVID-19 infection, but that requires a lot of work before we know if it's safe and effective.
All right, we'll leave it there. Dr. Joseph Vinet, thank you, sir. Thank you so much.
My pleasure.